Hello, my name is Sundari Vardarajan, and I am a senior student at the College of Nursing at UCF. Um, I'm currently completing my practicum uh, at Advent Altamont, and I've thus far completed 6 shifts. And I'm just going to talk a little bit more about some of the patients I've come across. Today, we're going to be going a little bit more deeper into a structured SBAR report on one of the patients that I had the pleasure of taking care of with my preceptor. So I'll go ahead and I'll begin. The situation that we had today was a 97-year-old male, and he was admitted on June 10th of 2026. He is currently full code. He came to the hospital because he had become severely dehydrated and malnourished after not being able to maintain adequate nutrition. His past medical history was quite extensive. It included conditions such as like atrial fibrillation, COPD, and he also has failed his swallow evaluation, so he did have dysphagia. Since he had failed his swallow evaluation, he was placed on strict NPO status because of his high risk for aspiration. And in order to meet his nutritional needs, he was receiving TPN via IV access. He also did have a condom catheter in place and was voiding without any difficulty. During my shift, he was pretty much drowsy for a lot of it, and for most of the day, he did respond to verbal and tactile stimuli. Okay. The background we have is that the patient's hospitalization was mainly related to dehydration and poor nutritional intake caused by severe dysphagia. Because he couldn't swallow safely, he wasn't really getting enough food or any food at all, or fluids, which led him to decline. He is also on 2 liters nasal cannula of oxygen. And due to the failed swallow evaluation, the care team did determine that it's safe for him, that it wasn't safe for him to have anything by mouth. TPN was started to provide adequate nutrition while discussing a more long-term solution. His daughter had been very involved in his medical decision and expressed that she would like him to have a G-tube placed. Her hope was pretty much that the feeding tube will help provide some temporary nutritional support, allowing him to regain some of that strength that he has lost, and eventually become a little bit more independent with his daily activities again. Now, before planning the G2 placement, the patient did receive a platelet transfusion. The purpose of administering these platelets before the procedure was to help reduce the risk of bleeding during the G-tube insertion by improving his body's ability to form clots. So now, since the G-tube placement is considered an invasive procedure, ensuring that adequate clotting is an important safety measure that needed to be taken place. The patient was also being seen by physical therapy, whom I also got the pleasure of working with throughout his hospitalization. Even though he is elderly and very weak at the moment, the therapist noted some gradual improvement in his strength and mobility. Physical therapy also provided education and recommendations to help minimize his independence as he continues to recover. Okay, so next, moving on to assessment. When I had assessed the patient, he did appear very frail and weak. He was consistently alert and not very oriented to time, really. He did respond appropriately to verbal cues and touch, especially when I would assist my preceptor with any of his medications or assessing his vital signs, which was important to do every 1 to 2 hours on that shift. Although he required a lot of assistance with most aspects of his care, he did also show small signs of improvement with therapy, um, like sitting at the edge of the bed or, being able to stand on his own with a little bit of support from the therapist and I, and being able to sit back on the bed. Um, his hydration did also improve with IV fluids and TPN, but the nutrition aspect of it remained one of his biggest concerns, since he was unable to eat or drink anything safely. His condom catheter remained in place and it was functioning appropriately, um, with adequate urine output throughout my shift, well over 30 mLs every hour, um, and also monitoring his intake and output was important to evaluate his hydration status and kidney function. Because of his COPD, I closely monitored alongside my preceptor his respiratory status, oxygen saturation, and breathing efforts. He was on continuous oxygen, 2 liters, as I mentioned earlier. And so since aspiration was a major concern in my patient's status, with him having dysphagia, aspiration precautions remained in place at all times. So he did remain NPO. His atrial fibrillation also required ongoing monitoring of his heart rate and rhythm, and he was on a cardiac monitor as well, in order to identify any sort of like significant changes in his cardiac rhythm. Okay, following the platelet transfusion, I monitored him for any signs of like transfusion reaction, like including fever, chills, rash, shortness of breath, or changes in his like vital signs, alongside my preceptor. He tolerated the transfusion very well, actually, without any adverse reactions. So that was good. I also continued to monitor for any other vitals that may have been an issue for him to kind of continue on with his scheduled G-tube procedure. Another concern was maintaining his skin integrity. Because of his age and like poor nutrition and limited mobility, he had an increased risk for like pressure injuries. So we were frequently repositioning him and doing routine skin assessments, which was also a very important part of the nursing care as well. As I mentioned earlier, it's something that really stood out to me was his participation in physical therapy. Even though his progress was very slow, he was improving, and that was something that really stood out to me. It showed me that pretty much with consistent therapy and proper nutritional support, he would be able to kind of regain some of that strength. Okay. Some recommendations I think would be to continue with the planned G-tube placement once the healthcare team, of course, determines that it's safe to proceed. Since he's unable to safely swallow, I think the G-tube would provide him a more appropriate long-term method of nutrition than continuing to just, let alone TPN. of course, the goal is here to improve his nutritional status and increase his strength and energy, and to support his participation in the ongoing physical therapy that he would be doing. Um, as his condition improves, and speech therapy, I feel, can continue to evaluate his swallowing ability to determine whether he may eventually be able to either like return to oral nutrition at some point. I would also like recommend continuing to monitor his platelet count and laboratory values related to any bleeding, to ensure he remains, of course, stable prior to and after the procedure. Also, again, to mention, physical therapy should definitely continue because the patient has already shown signs of improvement, and I think that's important in maintaining a consistent rehabilitation, which can help him regain more independence with his ADLs and his day-to-day activities. From a nursing standpoint, I would continue to monitor his like respiratory status, his cardiac rhythm, nutritional therapy, intake output, urine intake output, skin integrity, and overall response to treatment, while maintaining aspiration precautions until needed. Some challenges, I would say, perhaps with this patient was how medically fragile he was. At 97 years old, with several chronic illnesses, even small setbacks had the potential to significantly impact his recovery. Another challenge was his decreased level of alertness, which made communication and patient education a little difficult. I also did notice that although his daughter was very supportive of his care and advocated for the G2 placement, family members were not consistently present during therapy sessions or nursing care, which I'm sure is very hard on them as well. And because of this, they may miss opportunities to I guess learn ways to support him after discharge. I feel that family education is a very important part of his ongoing care, and would be very important. I think that his dysphagia also made his care more complex, because we don't realize how important it is to have the ability to swallow, because it affects his nutrition, it affects his hydration, it affects his medication administration, and it just poses such a high risk for aspiration. And that goes back to one of the first things we ever learned, ABCs, know your ABCs: airway, breathing, and circulation. And okay. So plan of care. Okay. The overall plan of care for him was to improve the patient's nutritional status through the G2 placement, so he can regain some strength and continue participating in rehabilitation. Until then, nursing care includes continuing TPN as ordered, monitoring the patient's laboratory values, maintaining aspiration precautions, monitoring intake and output, and assessing his respiratory status, cardiac status, providing routine skincare, repositioning him frequently, and monitoring his catheter. I think once the G tube is placed, nursing care will probably focus more um, on monitoring like the insertion site, assessing signs of like infection or bleeding, um, and of course ensuring if he's like tolerating his tube feedings, right? And educating not only the patient but his family on G tube care and feeding appropriately. Um, Another important part of his plan of care is continuing the physical therapy because um, he's already shown so much progress, and I feel that with some consistent support and repetition, I think that will really help guide his road to recovery and being able to just be more independent um, in this journey. Even though his recovery is going to take a lot of time, um, I feel that every improvement in like strength and like mobility can increase his independence. Um, so like overall, I feel like something that stuck out to me a lot is this patient really reminded me how important interdisciplinary teamwork really is. And this goes to say that like nurses and physicians and speech therapists, physical therapists, nutritional specialists, and most importantly family, they all play such an important role in helping patients recover. um, um, while, as I mentioned before, his situation is a bit more complex medically, um, I believe that with like continued support, he can truly gain a lot of independence, slowly. Okay. So next, we're gonna move on to some guided questions that I'd like to discuss a bit more, and I'd like to talk about like a few clinical skills that I've kind of become a little bit more confident in, and things that have possibly helped me build that confidence a bit more. Um, okay. And I'd also like to discuss some challenges that I faced and why they may be. Okay. Um, so over the past few clinical like rotations, I've certainly noticed I've become a lot more confident in several nursing skills. One of my biggest areas of growth has been performing a head to toe assessment. Going back all the way to like nursing school, I remember just feeling so overwhelmed because there were many different body systems to assess, and I was worried about forgetting something, that may have been very important. Um, I have spent a lot of time looking at my notes or mentally checking off like each step as I would go. Now, I think practicum has helped me with that. I am taking on a bigger load with, patient care. My nurse would have about, 4 to 5 patients at every shift. I think that has helped me, in this way, by repeating these assessments during clinicals. I've also become like much more organized and more efficient. Um, I feel more comfortable like talking to my patients while completing the assessments instead of like, being like a task rabbit, just like focusing only on like a checklist. Um, I've also become better at like recognizing what's considered perhaps like normal values versus what findings might need to be reported like to my preceptor for perhaps intervention. This sort of like repetition and having the opportunity to perform assessments on different patients with um, different like medical conditions has truly helped me build like my confidence. Another skill I've become more confident and comfortable. I've become more comfortable with is communicating with my patients, and this is like actually a really important one for me. At first, I was very nervous about like introducing myself and you know starting conversations, um, especially with who were like patients who were like confused or perhaps like hard of hearing, or experiencing some severe illnesses that may or may not change their lives from here on out. um, I wasn't always sure, well, like what to say. I was like worried about saying like the wrong thing. um, i've always um, I've always like continued as I've continued through clinicals. I've realized that building rapport doesn't really require having the perfect words. Sometimes just listening, showing empathy, and explaining what I'm doing and making the patient feel comfortable truly goes a long way. I've also become more confident communicating with other nurses as well when it's appropriate, and as well as other members of the healthcare team, especially like the patient care technicians who have been angels in disguise in my clinical rotations. Um, Physical therapists and providers are also sometimes, when appropriate, I have been able to, um, collaborate with and just kind of ask questions. Um, and overall, I feel like I still have like so much more to learn. Um, but however, I'm like a lot more comfortable asking questions when I'm unsure, and that's because I've like realized that an important part of being a safe nursing student right now, and one day a registered nurse, this is a very important part. Um, I've also gained some confidence with basic nursing skills like taking vital signs, checking blood pressure, glucose, and assisting with activities of like daily living, documenting assessments, and working alongside like wound care nurses and being able to be a helping hand. Um, these skills have become a much more natural part of my day to day during my shift, because I've had the opportunity to perform them repeatedly in different patient care settings. I've learned that confidence doesn't like come from doing something perfectly the first time. It comes from practicing consistently, asking for feedback, and learning from each other's experiences, and each experience, of course. One thing that's really helped me build confidence is working alongside some very experienced nurses. They've been very supportive in allowing me to practice skills while also providing guidance and like constructive feedback. Every time they explain like the reasoning behind, like an intervention or answering one of my questions, it truly helps me connect what I've learned, in the classroom with what I'm seeing in the hospital as well. I've also learned a lot by like observing how experienced nurses communicate with patients, prioritize care, and also stay calm during busy situations. Um, Even though I've made like a lot of progress, there are still like some skills that I find challenging, and one of those I would say, right off the top of my head, is like IV insertion. How Although I like understand how the procedure and the steps are involved, I haven't had many opportunities quite yet to actually perform it on patients. Um, it is a skill that of course takes a lot of practice, and every patient's veins are of course so different. So I know confidence will come with more hands-on experience, and I hope to get that um, in the coming shifts. I also know that like successful IV insertion requires like, of course, patience, like good technique, and being able to stay calm if the first attempt isn't really successful, and that's okay. Um, another area that I'd like to start practicing is giving a mock bedside report and communicating during shift like handoff. I sometimes like find myself. I sometimes find it challenging to organize all of the patient's information in a way that's like concise, while still making sure I include all pertinent like information. As patients become like more medically complex, there's a lot of information to remember, and I want to continue improving my ability to like prioritize the most relevant information, of course. And I know that with like effective communication during handoff, um, I know that effective communication during handoff is essential for, of course, patient safety, and so it's something I definitely plan to continue practicing throughout the rest of my shifts and all the way into my nursing career. Um, Overall, I've honestly learned that confidence in nursing isn't really just about like knowing everything, because we don't all know it, right? It's also about continuation, having a continuation in your learning and asking questions you know, when you need help, and taking um, every clinical experience as an opportunity to truly grow. Every patient I care for teaches me something new. I feel that each clinical rotation has helped me become more prepared and more confident as I work toward becoming a registered nurse. Okay. Um, next, next, I'd like to describe how I've handled situations when I'm unsure about like a procedure or intervention. Um, okay, so one thing in this is one thing I've learned is it's okay not to know everything, as I mentioned earlier, and patient safety always comes first. And when I'm unsure about like procedures or like interventions, I never guess or try to like really figure it out on my own, and that's okay, because I'm here to learn. And instead, I ask questions and review the patient's chart if needed, um, and kind of lean on my preceptor a little bit to um, kind of help guide me, with those questions, and coming more prepared. I realized that like asking questions isn't truly a weakness. It's actually being part of being a safe nursing student, and one day a nurse, of course. Um, so talking about this, like one situation I'd like to kind of dabble on again is um, the most recent shift that I had with my 97-year-old patient who had severe dysphagia and was, receiving TPN and was scheduled for like a G-tube placement. Um, before the G-tube placement, he did get a platelet transfusion, and was although we had learned about what blood transfusions were in class, I wasn't completely confident about why platelets were being given before a G-tube placement, but G-tube procedure, and what I specifically needed to monitor for after. So and so in this case, instead of like making assumptions, I asked my preceptor to explain the reason behind it, and he was so kind, and he walked me through the platelet transfusion process, and what and why it was being infused, and how it would help reduce the risk of bleeding, how it would help the risk of bleeding during the procedure, and review the signs and symptoms of transfusion reaction that we needed to monitor for, such as like fever, chills, rash, shortness of breath, and other changes in vital signs. So this experience like really helped me connect what you know I had learned in the classroom, and what I was seeing in like the clinical setting. Um, and it also reminded me how valuable experienced nurses are, as teachers. Every time I ask a question, I leave with a better understanding and feel more prepared the next time I encounter a similar situation. I also find that discussing things with my nurse helps me understand the patient's plan of care from like different perspectives as well. Um, and nursing is very much like a team effort, and I've learned that no one is expected to know everything like on their own. um, so overall, whenever I'm like unsure, My approach is to just like slow down, ask questions, and use like reliable resources and learn from my preceptor and of course the healthcare team. Um, I'd much rather ask for clarification than risk making a mistake. I think that mindset has helped me become more confident with each clinical shift, and it's something I plan to carry with me throughout like my nursing career. Okay. What kind of feedback? Moving on. What kind of feedback have you received from your preceptor so far? How did you take the feedback and apply it in your practice? Okay. One of the most valuable pieces of feedback I've received from my preceptor has been to be more eager to learn and not be afraid of making mistakes when appropriate. Early on in my clinical rotations for practicum, I think I was more focused on not doing anything wrong, that I sometimes like would hold back and from like asking to like try new skills or getting more like involved. My preceptor has ongoingly, reminded me that I'm in nursing school to learn and that nobody expects me to know everything right away. Um, Both my preceptors have emphasized that like making mistakes, when made in a supervised learning environment, um, become some of the best learning opportunities, as long as patient safety is always the priority. Um, Another piece of feedback they gave me was to speak up more if I wanted to experience something new. They told me that nurses and preceptors can't always tell what I'm interested in learning unless I like communicate that. Whether it's like observing a procedure or helping with wound care or watching assisting with like another skill that falls under my like scope of practice as a student. They encouraged me to like ask questions and let them know that I wanted to be involved. That really changed my perspective because I realized that many learning opportunities come from simply being willing to ask or offering help. Um, I took that feedback to heart. I made a conscious effort to become more proactive during clinical instead of like waiting to be asked. I started volunteering to help with patient care whenever it was appropriate. I also became more comfortable asking, more questions about like medications, procedures, why are, certain interventions being done. I found that as I was asking more questions, the more confident I became, and I understood not just like what we were doing, but why were we doing it. Um, okay. One moment that really stands out was caring for this patient who had the G tube, who had the planned G tube placement. Um, yeah. Um, so, like looking back, I think that feedback has made a big difference in my growth as a nursing student. Um, and I think that, learning every day, um, I'm still learning every day, but now I understand that confidence doesn't come from already knowing everything. So, yeah. Oh, and to add that, nursing, learning truly like never stops. And, you just keep growing and you keep trying new things and ask questions and always be curious. So that was really big. Um, okay. Talk about your experience with nursing documentation and what have you been able to document? What strategies have you seen or used to make sure documentation gets done during a busy shift or during a critical event? Okay. So over like the past several like clinical shifts, I've definitely become a lot more comfortable with nursing documentation. Um, if we want to go all the way back to like nursing school, like beginning, um, excuse me, documentation honestly felt a bit more like overwhelming, because I quickly realized like how much more information nurses are truly like responsible for documenting. I was always worried about leaving something out or not documenting, something, or documenting something like incorrectly. Um, and as I began to like, practice my documentation more during my shift, and getting co-signed under my preceptor, it's helped me realize how very much important it is for patient care. um, it also Documentation also communicates like what's happening with the patient, to also every member of the healthcare team, and it also helps ensure like continuity of care throughout the patient's hospitalization stay. It also helps us understand, small declines or, improvements, and where that puts that patient's care. Are they going to go home? Are they needing to stay longer? Are they needing to, you know, get, step down to perhaps a med surg unit, or, is there a case becoming more serious where they would need to be, sent to the ICU? So I feel like that's a very important part. Um, so far, I've had the opportunity to document like a variety of like nursing assessments, like interventions under the supervision of my like preceptor. This would like include like, your head to toe assessment, vital signs, pain assessment, blood glucose checks, intake and output, like their mobility status, skin assessments, fall precautions, and the patient's like responses to different interventions. I've also gotten the opportunity to like document patient education when appropriate, um, as well as like changes in like the patient's condition that needed to be communicated, perhaps to like the healthcare team. Um, One thing I've noticed from working alongside like experienced nurses is that um, they don't wait until the very end of the shift to complete all of their charting. Like whenever it's possible, they document throughout the day, after completing an assessment, administering medications, performing like any intervention really. Um, my preceptor has emphasized that documenting as close to real time as possible like also helps like improve accuracy, right? Because the details are still like fresh in your mind. So he or she has always told me to take a few minutes. If you find a few minutes, you need to kind of document as you go, just to be more efficient with your day as well, because things can really get super busy or may slow down, depending on how many patients you have and how severe their cases are. So I'm definitely trying to adopt um, some of those habits into my clinical experience as well. Um, um, one strategy that's helped me personally is organizing like my thoughts before I document. So after completing like my assessment, I mentally walk through the patient, from head to toe, make sure, excuse me, I haven't forgotten anything like that's important. And if it is particularly, excuse me, if it is particularly a busy shift, I also like review my patient's chart and my notes like before documenting, so I can ensure like everything is like accurate and complete. I've learned that taking an extra minute to like organize my thoughts helps improve both like the quality and the efficiency of documentation. Overall, I know I still have like a lot to learn, but each rotation has helped me become like more confident. Uh, I see nursing documentation um, as much more than simply like entering information into the computer. Like it's a way to communicate with the rest of the healthcare team and promote like patient safety and like provide accurate record of the care that's being given. Okay. Um, so to think back, next question, to think back on a time when I've noticed a subtle change in a patient's condition, maybe over the course of a day or even across multiple shifts. What were the early signs you picked up on, and how did you respond? What did you learn from this experience? Okay, so I'm gonna go back and touch on my 97-year-old gentleman that I had been taking care of. One of the subtle changes I noticed wasn't necessarily something like dramatic, right? But rather a gradual like improvement in his like responsiveness over the course of the day. At the beginning of my shift, he was drowsy. He spent most of his time like sleeping. Although he would respond to like verbal and tactile stimulation, it was more. It took more effort to wake him up, and he wasn't really interacting much. As the day went on, and we continued, like monitoring him, I noticed that he had become a little bit more like alert during assessments, and especially when like physical therapy came to work with him. He was still very weak, but he seemed much more engaged than he had been earlier in the day. One thing that really stood out to me, and I still think about it during that physical therapy session, was when the therapist talked to me about the importance of keeping the curtains open and allowing like natural sunlight into the room whenever possible. They explained that exposing him to natural light could help reset his circadian rhythm, and that's not even something that crossed my mind, honestly. Um, Especially since he had been sleeping for much of the day and spending a lot of time indoors. I hadn't really thought about how something so simple as natural light could play such an important role in this specific patient's like recovery. It reminded me that like recovery isn't always just about like medications and like procedures. Small environmental, interventions like promoting a normal sleep-wake cycle can improve alertness, encourage participation in therapy, reduce any sort of confusion he may have, or ultimately help support his overall healing and rehabilitation. Um, because I did notice these gradual improvements, I continued paying close attention to his neurological status, vital signs, and overall response to treatment during my shift. I shared my observation with my preceptor, and together we continued monitoring his like hydration status, nutrition, and participation in therapy. We also monitored um, what well okay, so moving on, what I learned from this experience is that not every important change in a patient's condition needs to be like so dramatic. Sometimes it's like the really small changes that tell you whether a patient is improving or beginning to decline. A patient becoming a little bit more alert and like participating more during therapy or responding differently during your assessments can all like provide like valuable information. Those small observations, when like combined with like vital signs and like lab values and overall like clinical picture, help guide the plan of care for a patient. This experience also reinforced the importance of like performing thorough like assessments every time possible, of course, because it does get busy, and sometimes even if the patient appears like stable, take those extra few minutes to assess your patient. If I simply assumed that he was the same as he had been earlier in the shift, I might not have appreciated, I guess, these small improvements that I was able to see. It also taught me to appreciate how valuable every member of the interdisciplinary team truly is. Something as simple as keeping the curtains open, said to me by the physical therapist, gave me like a new perspective on patient care and showed me that recovery often depends on small changes and interventions that work together with, as a bigger picture. Um, Overall, this experience taught me to, trust my assessment skills a bit more, pay attention to even subtle changes, communicate my observations with my preceptor and the healthcare team when appropriate, and never to underestimate how small changes can be, guided guiding patient care and support a patient's recovery. Okay. Okay, that pretty much sums up my post conference for this assignment, and that's all.